to Ways to Flourish. I'm Lindsay Heck. I'm here with Dr. David Dafashy of the Student Health Center.
Thank you, Lindsay. It's so good to be here.
So can we talk a little bit about depression in particular and situational versus chronic depression?
I think it's so important to understand that depression and anxiety, like so many other diseases, really very broad spectrum, right? And the truth is that no one's pain is less important or less than another's necessarily, but everyone experiences depression and anxiety in a very unique way. And I do think there is there's a couple, distinctions that I think are worth making. And one is what we call situational depression, sometimes referred to as adjustment disorder. And then we have sort of some of the more chronic mental health issues, like chronic major depression, bipolar disorder, generalized anxiety disorder, so OCD, for example. And I think that for some folks, the chronicity and the intensity of the depression or the anxiety can be a little bit more difficult to treat. It can be more refractory to treatment. We have found that about 50% of what we call severe mental health disorders actually happen by age 14, and about 75% happen by early to mid-20s, okay? So situational depression, on the other hand, is more common, okay? And you can think of it like this. Situational depression, we can actually look at a specific event that's happened in somebody's life. It could be a traumatic event such as the loss of a loved one, loss of a pet, a divorce, the end of a relationship, right? Physical health issue that arises. All of these are what we call situational stressors. And while we might be able to cope with one situational stressor, if several of them are piled on at once, we may feel overwhelmed, where the individual can very readily and very easily point to something and say, this is what's upsetting to me, this is what's bothering me. I don't feel like I have any control over it, and I'm powerless to change it, and that's causing me to feel the way that I do. So that's really a situational depression. I would argue that almost all of us have had some element of that, right? Where we can actually point to something and say, this is just a terrible thing. I wish I could change it, but I can't. And I'm feeling badly about it. Now, grieving is not the same, obviously. Just because something bad happens in our life doesn't mean we're situationally depressed. But sometimes when the feelings linger, that can result in what we call situational depression. Situational depression tends to be very treatable with talk therapy or other forms of cognitive behavioral therapy, and with medication. Okay, and sometimes we decide to take a more integrated approach or use both modalities. Sometimes one person will choose one or they'll choose the other. Kind of depends on what's right for the individual. But yeah, so situational depression, more common, more acute, tends to be treatable, and it tends to respond to treatment and doesn't always recur. Chronic depression, like I said, folks who have struggled with depression and anxiety since a very early age are unfortunately more likely to struggle with it in a more chronic way. And again, it does not mean that that's a state of affairs it will always be, but it does mean that individuals need more intensive and more longer-term therapy. They may require longer-term medication. In the case of bipolar, sometimes that's a medication that you stay on for a long time. I never say lifelong because things do change, but I think it's an important distinction to understand that for some folks, unfortunately, it is a chronic, recurring, relapsing condition, and for others, it's a little bit more of an acute situation. You think about it, like I hate to use the analogy of cancer, but some people have an acute skin cancer, they have it removed, and that's the end of it. Other people have other types of cancer, and they may have recurrences over many, many years, and it continues to recur. The treatment is, like I said, largely the same. It's really a question of how long it lasts, and again, sometimes with chronic major depression, we find that relapses are not entirely uncommon.
So when you're talking about someone who is living with chronic depression, it could be waves of up and down, always feel constantly depressed, or is it both and?
Right.
You have, a consistent feeling of...
Well, we use the term chronic dysthymia sometimes when people are kind of feeling maybe less than what we would think is being ideal or optimal over time. But as a general rule, even people who have major chronic depression are going to experience periods of uplifted mood, and it may have hopefully long periods of remission, right? So left untreated, chronic depression can result in years and years of disability and feeling poorly. The general course of chronic depression is that it does wax and wane, right? And I think the goal of the healthcare community and of the individual really should be, how do I get a handle on this so that it is as minimally disruptive to my life as it possibly can be? And again, through appropriate therapy, healthy life years, medication therapy, a lot of these people can enjoy long, healthy, and very happy lives.
And right now, there's this mental health crisis that's coming up and emerging. So much situational depression is arising right now in a wide spectrum of response to what's going on in the world. But really, I think that the biggest thing for people to understand is that, this is hard for all of us right now, right? And so that understanding too, there are people who, even after this, time in our life passes, and hopefully when we get to that point of where we move past that pandemic, hopefully some of these feelings will, and then with the chronic and ongoing, what would you recommend? Just continuing on those paths of treating the body, the mind, medication as needed?
Absolutely. I think that the key is to understand there are aspects of mental health that are outside of our control, right? We know that some people have chronic mental health illnesses that go beyond just healthy life choices. But I think if you arm yourself with those healthy life choices, keeping your body physically healthy, because the mind-body connection is so strong, keeping yourself physically healthy through those basic building blocks of wellness, good exercise, good nutrition, good being socially connected, volunteerism, laughing, all those things that actually we know lead to better physical health. I think those things can only help us as we work on the mental health part of things, and understand that we are living in an increasingly complex time, right? And with increasingly large numbers of demands being placed on each and every one of us, and those of us who have situational depression, we may be able to cope and see resolution of our symptoms through short-term therapy, short-term medication, and healthy lifestyle choices. And those of us with chronic mental health issues, we may find ourselves obligated to recognizing that it's an ongoing battle for us. But the key is just to persevere and to continue, to work in conjunction with whether it's a therapist or a doctor, and also just kind of staying socially involved and developing those meaningful relationships that just
making that conscious choice every day. So if there was someone listening who was living with chronic depression and maybe hadn't taken those steps to go to help, what would that advice be from you to give to them?
I would say to that person, don't try to do it alone. Understand that you have a lot of control over aspects of your life, but at the same time, I think the collaborative approach of really sitting down with a trained therapist and sitting down with your physician and having an open conversation about your expectations, your concerns, where you think you are, I think will lead to the best outcomes. So I love the collaborative approach. I love empowering patients to take charge of their health, whether it's mental or physical, and we're just happy to be their guide, but clearly they're the ones in a lot of ways steering the wheel.
Join us tomorrow as Dr. David Dafashy talks with us about the long-term impacts of stress on the body and some helpful tips on how you can manage your own.